Welcome to Industry Insights with Route Consultant, your front row seat to the fast-moving world of logistics and beyond. Each week, we bring you game-changing insights, real-world strategies, and fresh perspectives to fuel smarter investments and build stronger businesses. Join us as we sit down with expert guests to explore emerging trends and pressing topics across a wide range of industries. This is Industry Insights. Hey everyone, welcome to Industry Insights. This is a special episode that was actually recorded live at the Route Consultant Expo in 2026. We're releasing this over time so that if you weren't at the expo, or if you missed the session, or if you're just catching up, these are all coming out over the course of the year so that you can go back and watch this content and make sure that you see everything that we went over at the expo. Today we're going to hear from Roland Brewer, the president of Realm Health, about how you can maintain your healthcare costs in an ever-changing market.
It's like year 6 for us doing Route Consultant Expos, and this has absolutely been an incredible show, so I hope you're enjoying it. The sessions have been wonderful. I like the whole setup in here. I think it's really been good. So my name is Roland Brewer, and I am the president and one of the founders of Realm Health. And thanks to these expos, and thanks to people just like you that are already with us, et cetera, we have become the largest benefit provider in FedEx Ground. Now, we're not perfect, but we do have solutions. So I do want you to make sure that you come over to our booth, go to booth 401, go up to my lounge. Y'all missed it if you didn't go up this morning. We did have mimosas and that kind of stuff, but at 12 to 2, we actually have our lounge open again. So open bar, feel free to come up there. So today, the session's not going to be about selling you insurance. I'm going to be here to educate you about what's going on in the healthcare industry today, why costs are going up, why costs are through the roof. Hopefully you're going to get some nuggets to be able to help understand what's happening to premiums, why the insurance is so expensive, how you can negate some of those things and help lower what's happening. So a little bit of housekeeping. So you might have a little sheet next to you with a QR code. That's going to be for question and answers. Please, I mean, if you're anything like me, I all of a sudden the speaker is talking, I come up with a question, and by the end of it, I forget what it was. So make sure you scan the QR code. We have people over here monitoring any of the questions that you're sending in. We've already had some people that asked some questions, thought they were good questions. We kind of loaded some of those from earlier questions yesterday and today. So just make sure you utilize that. And again, as I said, this session is not going to be about selling insurance. So it's about avoiding mistakes that are quietly costing you as a business owner. Literally, it could be costing you thousands of dollars a year. So we want to make sure we address that. Today, there's going to be 3 main things that we're going to talk about. Actually, what's driving up healthcare cost, why doing nothing in 2026 is going to make it worse, and then how benefits can become a cost control and a retention weapon. So how benefits can become a cost control and a retention weapon. And I don't know if you've thought about benefits that way, but it's extremely important as we go through. I think we're going to be able to educate you on how that's going to work. So quick show of hands. How many right now offer benefits to your employees? Okay. Y'all kind of glance around and see those hands. It's not a lot. Why do you think that is? He's doing this. It's cost, right? It's expensive. So we want to show you how it cannot be expensive. In fact, a gentleman that was sitting up here talking to me earlier was like, hey, I mean, it really doesn't cost us anything. And you need to, and he's with us, and he goes, you need to make sure they understand. I mean, here he has a company, and it does not cost them anything. Now, is he contributing? Yes, he's contributing. But it's because of the solutions and the things that he's doing to get tax write-offs, et cetera, how truthfully, it's not costing him anything. So he's able to do that. The other piece that I kind of want to bring up, so how many of you that had your hands up, how many of you have had rate increases on your products, on your insurance? Okay. So we're going to address some of that today. We're going to tell you why rate increases are happening and how hopefully we can minimize those rate increases. For the ones that raised your hands, how many of you had double-digit rate increases? Yes? Hey, we've literally seen in our office people that have come to us, contractors just like yourself, business owners just like yourself, that literally had 60% rate increase last year going into this year. 60%. That's absurd. It is really, really difficult for you as a small business owner to have to negate that problem. So let's start with why this all matters, what I'm talking about, and again, how to negate these things. So let's talk about why this matters, and specifically to you as a small business owner, how this affects you. So I'm going to talk, since most of this is about transportation in here, and again, if you have any other small business, the same thing goes into effect, but we know this at Realm Health. We know that you're working typically on tight margins. Would we agree? I mean, there's pretty tight margins. So turnover, this is a high turnover business. That revolving door is going like this. I mean, literally, we've talked to people, there's been up to 100% turnover in a year. So I would safely say that I think people are in this industry, 50% turnover is not uncommon in a year, especially on the P&D side. Maybe not so much on the line haul side, but on the P&D side, it's happening. The work that they're doing, they're typically on the P&D side, they're typically on and off a truck a couple of hundred times a day. It's physical, it's demanding. You go out today, the weather's been bad. Listen, we understand it. They're having to get on and off that truck. It's kind of annoying. You know, they're going up 3 flights, 5 flights of stairs, delivering packages and having to deal with the weather, dealing with the physical demands, et cetera. So we understand that. And I think this is important as I'm going through, when you're looking for health insurance, when you're looking for a broker and they don't understand this industry, they're just trying to, they're literally trying to just say, here's the typical product, here's a major medical plan, a BUCA plan, and when I say BUCA, Blue Cross, United, Cigna, Kaiser, Aetna, those kind of deals, they just say, here it is, but they don't really understand what you're going through, they don't understand what your employees are going through. So they just bring the one thing to the table, and that's really it. Now, it might be multiple plans, but that's all they're doing. We're trying to make sure that we say, listen, when you're looking at benefits for your employees, here's what I believe and my staff truly believes is important. You have to remember, and please don't take this in a bad way, you have to remember this. The benefits, not that you don't need insurance, it's fine, but the benefits are about them. So what they can afford and what they need is typically much different than what we as business owners can afford and need. So you have to understand, just because it fits you and you're needing major medical or one of those things, doesn't mean that the employee that's 28 years old, a male, that still has an S on his chest, is looking for the same thing necessarily. Does that make sense? All right. So I talked about turnover. So let's talk about the high turnover, and that actually makes it extremely tough for insurance companies to be able to give you a rate that's solid, sticks there, and keeps from going increase. The reason is, with this high turnover, you actually have to have a certain amount of persistency in order for them to want to keep you on the plan. I got a head shaking. So you typically are going to have 75% participation. Now, that's of eligible employees, but that's pretty difficult. So when we stepped into this a little over 6 years ago in this space, very specifically the FedEx and the last mile delivery space, that's the big problem. Besides affordability, it was like, well, I can't ever keep enough employees that can afford and want to be on the plan to be able to maintain the coverage. Because the big bukas of the world, once you fall under that, now they're not going to cancel your insurance right then, right? But when it comes to renewal time, they're going, hey, you only have 2 employees left. You only have 1. That's a problem. So the high turnover is truly a tough situation for the typical insurance companies and insurance agents to be able to deal with. So you're always onboarding new people. That's another thing. They have to be educated. The employees, they're gonna typically get something. How many of you maybe have benefits now utilize like a system where it sends them an email and they just get to go online, pick their benefits, or maybe you have a booklet at the office. So when you hire them, you show them the booklet. They're looking at it going, this is confusing. I don't know what I need to pick. What fits me? Even at our office, our staff, when we roll out our benefits, my HR director's right here. When we roll out benefits, he's nonstop having to walk through with employees to explain how the plan works, what's going on. We don't want you to have to do that. You have a business to run. Let an industry expert, whether it's us or anybody else, let them walk through the benefits. That's their job. Yours is to make sure you're running the business. You're trying to provide benefits, so just make sure that you keep that in mind as you're looking. So it's not just an HR problem with the high turnover. It's truly a financial one. And I'm going to address that. So here's why people usually point the finger at these high cost of premiums. They're going, oh my gosh, the premiums are so high. The premiums are so high. Well, premiums are not the cause of the problem. They're the result. I'm going to say that again because that's real important. The premiums are not the cause of the problem. They're the result. So what does that actually mean? So it's how care is being used. So if employees don't understand how to utilize the plan, then they're really costing the company money. And by the way, I see some people taking pictures of slides. Correct me if I'm wrong. Aren't we going to post the slides? So we're going to post it, so you're going to be able to get these slides. So we'll post it online. So you don't have to worry about taking pictures if you don't want to. So it's not only how care is used, but where they're getting care, where they're going to go get the service. And it's also on the high cost of premiums, there's provider consolidation going on. So we're in Dallas, Texas. And what I can tell you is one of our big major hospital networks, hospital chains, is Baylor Scott & White. So here's what's happening. The typical, and this is happening all over the country, the typical mom and pop doctor office that Dr. Jones just has an office down here or an MRI clinic, et cetera, an imaging center, those are being bought up by the big hospital networks. Shaking your head. I mean, it's happening. So here's something that happens that none of us think about. It's not on our radar. When you go to that doctor's office, if the hospital owns it, and we've seen this, what would have been an outpatient charge at that doctor's office, because it ran through the hospital, because the hospital owns it now, sometimes the charge, when it goes into the insurance company, doesn't look like your typical outpatient charge anymore. It's actually being billed through the hospital. And they charge more at the hospitals through the insurance companies, okay? So there's upward pricing and pressure everywhere. Premiums are a scoreboard. They're not the game. Nowhere is it more obvious than in this one space, the emergency room. If any of you have been to an emergency room, you walk into an emergency room, what was an emergency room meant for? An emergency. Well, people are going in because they got a sore throat. They got a fever. They don't feel good. The ER charge, I mean, look at these charges. The ER charges are totally different than what it is if you go to an urgent care. You know, now we have urgent cares everywhere, but we kind of run away from it and we go to the ER. Why? Because it's convenient. That's what we know. I mean, you get a child with a broken arm today, don't go to the emergency room, go to an urgent care. They're gonna still do the same thing, and by the way, they're gonna take care of it, and then what are they gonna do? They're gonna go send you to a specialist because they need to make sure no growth plates were broken, et cetera, on a child. So if that would still happen at an ER, but they're gonna charge you these astronomical rates. Now, another reason, why did these employees go there? It's not only what they know, the hours they work. Now, again, I know a lot of them get off at 3 o'clock, et cetera, but think about it. They got to set these appointments at these doctor's offices, whatever, and you know what? They're lazy. They don't do it. They just go to the convenient way, go straight to the ER. These charges could have simply been eroded by using urgent care and virtual care. What do I mean by virtual care? How many of them know of telemedicine? Most people know of telemedicine, right? Did you know there's also virtual primary care? Do you know there's a difference? So when you go to telemedicine, you're sick, maybe you think you got a cold, maybe you think you got an ear infection. So you go and you can do that on telemedicine. But what if you're diabetic? What if you have a high blood pressure medication? So by having a virtual primary care, it literally takes the place of your primary care doctor. So think about this. If you're the line haul side, and these guys are driving at all hours, well, now they can pick up, do a virtual call with a primary care physician, and here's what a primary care physician can do. They can actually prescribe your maintenance medication. So if you're diabetic, they can call in your diabetes medication. High blood pressure, they can call that in. The telemedicine side cannot do that. So just by having virtual primary care and guiding people to the right places keeps those premiums from going up. So you see the non-emergency ER visit average cost, I mean, $1,200, $300, $3,000 plus dollars. So one bad ER, one bad emergency room claim can shoot those premiums through the roof. Again, you've got to make sure that we're finding plans that help you navigate to avoid those kind of things. And it's about, again, educating employees. They've got to do things differently today. And again, I don't want you to have to do that. That should be the job of the agency or the agent that you're working with. So here's a double-edged sword on this. The next piece that causes the problem is unmanaged care. So when you have unmanaged care, what is that kind of meaning? So you get people that have back pain. Now, maybe you don't have insurance, maybe you do, but they have back pain, they have knee pain, they're not going and getting it taken care of, and then what's next? It gets so bad, and it really comes into play on diabetics. If they don't manage it, and we see it a lot in the line haul side, they're not managing those things. So the next thing you know, it gets worse and worse and worse, right? Now it becomes a hospitalization. Now it becomes a surgery that has to be done. So by managing these things and having a benefit plan where they can go get these things taken care of, it truly, again, will save you a lot of money. Small problems ignored become massive claims. Again, all of a sudden they're hospitalized, they're having to get surgeries, et cetera. So when you layer on that, along with the fastest growing cost of all, Big Pharma. The pharmacy stuff that's going on today, and I don't know how many of you saw what it was a couple months ago, Trump, not meaning to talk political, but he was on. One of the things they did talk about is they're trying to go after Big Pharma on some of these high-priced drugs. The prescription prices are through the roof, and Big Pharma controls it all. They're charging outrageous numbers. So the same drugs that we have here, the exact same drugs, you go get them in another country, they're significantly less. GLP-1s today, anybody know what GLP-1s are? You're probably hearing the term. That's the Ozempics of the world, Zepbounds. See, listen, that was created to actually help, it was the original, was to help with diabetes, and it was doing incredible stuff. But then all of a sudden people understood, oh, wait a minute, I can lose some weight. And so they realized, so now it's really become the weight loss thing. It's sure it still manages diabetes, but everybody wants it. So not only did everybody want it, Big Pharma looks at it and goes, oh, we can make the prices go up and up and up. So all of a sudden you have drugs that are thousands of dollars. Please tell me you do understand that if you have any health insurance plan, your $20 copay for a prescription is not taking care of that $13,000 drug. The $20 copay is not taking care of that. Does that make sense? So putting things in place to help control the big pharma pricing is extremely necessary. There's things called prescription advocacy programs, et cetera, that should be being utilized. So this is quietly becoming one of the largest line items in healthcare. Big pharma, all these high cost prescriptions are truly driving cost up, probably more than what we could ever imagine. In fact, there's a slide there showing the true spend rate over the past, I think that's 10 years. So let's talk about in 2026, right now, what will punish you if you ignore this? So we've got medical inflation, provider consolidation, specialty drug growth, labor competition. These are all driving costs, so these things are making it worse. Healthcare has grown faster than the inflation. Healthcare costs have grown greater than inflation has grown. It's outpacing it. So doing nothing at all, whether it's not getting benefits, not helping your employees understand how to utilize programs, it's only driving the cost. So what actually works and what are some solutions that can be done? So I mentioned earlier, not all plans are built the same. And I said, a typical agency loves to walk in and say, hey, here's the Bucas of the world, $2,500 deductible, $5,000 deductible, here's your copay, here it is, that's it. It's fine, but it doesn't fit everybody. If you have an employee, the average P&D, I'll start there, the average P&D worker makes $45,000 a year. Now that's a national average in FedEx Ground. $45,000 a year. You think they can afford $500, $600, $700 a month health insurance premium? So this is what I'm talking about. This is why all of a sudden we try to say, hey, I can afford that and I want it, so I think they need it. Then we forget they can't afford that kind of premium. Well, now, what about you? You actually have to pay a portion of that. Now, the Bucas of the world are going to tell you, you have to contribute at least 50% of the lowest premium product. $500, that means you're having to put up $250 an employee. Again, we talked tight margins earlier, right? Sometimes that's not affordable. The vast majority of small business owners that we talk to, that's tough for them to do. So unless you're over 50 employees, you don't have to meet those ACA guidelines. You don't have to contribute that much. But what you can contribute is what you can afford. Don't let an insurance agent tell you that you have to do 50%. If you're under 50 employees, that is not the truth at all. And again, the gentleman that I told you was talking, he doesn't even come close to that. He's under 50 employees. He doesn't contribute that kind of money. He can contribute what he can afford. So if it's $50, it's $50. I will tell you this, when you're doing these things, make sure you're looking, and the way we say it is, pretend that every single employee is going to buy a benefit. So when you're budgeting your money, what you're going to be able to contribute, pretend that every single one of them are going to take that $100 or $50 or whatever that dollar amount may be. Then that way you're making sure that it's fitting within your budget. Understand they won't all take it. That's just the facts of it. Again, a lot of younger males got an S on their chest, and they're also more concerned about where they're going to go get beer tonight. Now, when I say that, it doesn't mean they don't want coverage. If you're going to offer it for them, they're going to take it. In fact, we typically enroll 70+% of all the employees within a company on something. And again, if you're going to throw the one product set, the one health insurance plan that's $2,500 at them, well, all of a sudden you might have one guy that just says, listen, all I want is dental. All I want is telemedicine. That fits who I am. That fits what I need. That fits my budget. And whenever you're trying to get a participation on one of the BUCA plans, that makes it difficult. So, virtual care. I mentioned that. It's extreme. I'm telling you, when you're talking to an agent, find out if they have virtual care. Find out if they have virtual primary care. That's, again, different. A lot of them will go, oh, yeah, I got virtual care. They're talking about telemedicine. And that's fine. Telemedicine is good. You want that too. Simplified networks. Realize that if you have a Blue Cross plan, and again, like in our office, on our plans that we have at the office, we have multiple different networks, the same carrier. It just depends on which plan you're on. So one guy might have this network, another employee might have a different network because they're on a different plan, but the same carrier, the same insurance company. You following me? And they all have different rates and different charges. And then we also got to make sure that we're directing people to not so much go to the ER. Now, ER is necessary at times, but we need to make sure we're not guiding people to go to the ER. So the best plan, when you're looking, the best plan is one that drivers can actually know how to use. If they don't know how to use it, it's really not, and it's not affordable for them, it's of no benefit. That make sense?
Hey guys, we just wanted to pause for a moment to invite you to our free events that are happening throughout the year. Whether you're just getting started in the logistics industry or you're looking to optimize your current operation, Route Consultant has events that are designed specifically for you. So head on over to routeconsultant.com/events or check out our show notes to register for free today. Also, while you're here, don't forget to like and subscribe to the Industry Insights with Route Consultant podcast so that you don't miss out on the stories, the advice, and the updates that are happening throughout the industry. We appreciate you being here and hope to meet you in person soon. Now let's get back to the episode.
So, drivers typically don't have time. This is a real big piece. So, even the best plans fail without guidance. Best plans fail without guidance. So, drivers typically don't have time to fight hospital bills. And you're kind of going, well, why would they? If they have insurance, what do they need to fight a hospital bill? You know that 80% of all medical bills have discrepancies? 80% of all medical bills have discrepancies. Might have charged you twice for something. So it's really, really important to have programs like advocacy programs attached to whatever benefit that you're providing. Advocacy programs are extremely important, and so is having a concierge service to help guide them. Listen, if you go get an MRI or an X-ray or a CAT scan or any of these kind of things and you're going to an outside imaging center, do you even know that the time of day, they actually have different rates? They have different rates for cash. They have different rates for cash paying customers as they do for insurance. Which one do you think is more expensive? Insurance rate, by far. I mean, you'll see from one clinic to another, you'll see from a time of day where the charges are dramatically different. So why would you go pay thousands of dollars for an MRI when you might be able to go to the next clinic or at a different time of day and get it for $300? It's the exact same MRI. So having a concierge service to guide and direct them to wherever they can go, so then that way it keeps your premiums from going up. By the way, little kudos on us, we haven't had a rate increase in 6 years. I'm not saying we won't, not saying we won't have that happening, but we haven't had a rate increase in 6 years because we use things like this. We have concierge service, we have advocacy, but it's got to be utilized. Has to be utilized. All right. So advocacy actually protects the employee. It protects their family. and it protects your brand. So this is where trust is typically built or lost. Most people, when they go use insurance, the biggest complaint you ever hear is, that insurance is horrible. It didn't pay anything. Well, it paid, but you still have a responsibility. If you're on a Buca plan, you have a deductible and co-insurance. Forget the copay for a minute. You still have a deductible and co-insurance. Typical plans today that are being bought and sold are having to be somewhere in the neighborhood of about a $5,000 deductible. How many employees have $5,000, especially at the $45,000 income level? How many of them have $5,000 laying around? Oh, and by the way, it's a $5,000 deductible 80-20 plan. What does the 20 mean? It's 20% up to, as an example, $10,000. So that's their responsibility. So all of a sudden now we're at $7,000 before the insurance company pays at 100%. But employees tend to forget that part, and they go, oh my gosh, it didn't pay. This plan stinks. You could have had the best of the best. You could have had the biggest name plans in the world. Trust me, it will not always satisfy people, and it's typically about their lack of understanding what their responsibility is and what the insurance company's responsibility is. None of this works, though, if they wait to the last minute. None of it works if you wait to the last minute. You have to look at plans and make decisions today. So, renewal is not the time. You actually have to be planning ahead of time. So typically what happens is about 90 days, sometimes it's 60, you'll get your renewal in saying, hey, here's what it is. And again, we had some hands showing rate increases, et cetera, right? Well, all of a sudden, that's when we look at it. Well, a good agent will be able to go in, and they should be looking at this and kind of planning and going, oh, wait a minute, where's the ER usage? How is it? How's the pharmacy usage? To be able to help guide and direct you, saying, hey, look, I mean, for HIPAA purposes, can't tell you who it is or what it is, right? But most of you are in small businesses, you know if that employee's got something going on, you know that, but maybe you don't know about a family member. So being able to adjust and find plans that will help navigate and fit their needs, because they're maybe driving up cost, and an agent can be proactive and say, hey, look, we need to build something a little different, put something together, so then that way next year we don't have this problem. Is that making sense? All right. So let's talk about why benefits matter beyond the cost. Pay is table stakes. Schedules are similar. Again, if we were in this room and there was a big table and we threw up all the health insurance plans, threw them all up in the air, the vast majority are all going to land on the table. The ones that are on the floor, you sweep them out, right? But they're all going to land up here. So it's all really basically the same thing. You still got deductibles, you still got copays. The premiums are all going to be somewhat close. This year, United's going to be cheaper than Blue Cross. Next year, Blue Cross is going to be cheaper than United. They all play a game. They all play a game, and that you constantly have to switch. You got to bounce from this carrier to this carrier. We want to help keep you from having to do that. You want to find agents that are very proactive and agencies that are very proactive, and they're not just stuck in a box. So benefits stories win drivers. And I'm going to go through some of these in just a few minutes. So what actually keeps drivers? What retains drivers? So protecting families from surprise bills, easy access to care while they're on the road, being able to make things simple for them. They want to feel supported. Knowing that the coverage works is extremely important. Knowing that the coverage works. And I'm going to tell you, anybody that's been with us, here's one of the biggest issues. So if you're with us and you've ever heard, hey, there's no providers, nobody takes this insurance, I can tell you right now. So please, if you're with us, I want you to understand this. Here's the biggest problem. They call their doctor and they try to set an appointment. First thing the doctor does is say, what? Do you have insurance? They say, sure. What do you think they say? They say, I have Realm Health. Realm Health is not the insurance. Not one doctor's office knows Realm Health. You know what they do know? The PPO network. That's what's important. So again, agencies having to help educate to make sure that they understand when they call the doctor, it's about the PPO network or HMO network or whatever you may be in that area. We typically, at our office, the only thing we do is PPO plans. Don't have any HMOs. So let's put some real dollars to this. So and listen, you're gonna see some numbers up here on the screen. I'm not saying these are exactly yours, but I want you to understand this concept. So we did some research. We talked to recruiting firms, we've talked to Indeed, we've talked to all these people. So listen, replacing a driver costs somewhere between, I'm just gonna say this, it's gonna cost several $1,000s. Before they ever deliver a package for you, before they ever work officially, you onboarding them, you recruiting them, you training them, all of that, that's what these numbers here are showing. I mean, it's thousands of dollars. So I can tell you this, by having benefits, you are gonna reduce turnover. I've had employers come to me and saying, hey, thank you. I was actually able to hire this employee. First question he said was, do you have insurance? And by the way, it's not for me, it's for my wife. She needs coverage. So he wasn't gonna go to the contractor at this bay because they didn't have coverage, but he went to this one. So it's really, benefits are extremely important, especially in today's time. Lower turnover stabilizes claims. The more turnover you have, the insurance company, you got 20 on the plan, and all of a sudden you had 10 on the plan, and all of a sudden you have 5 on the plan, and you have one big claim, that makes it difficult. High turnover makes it really difficult. So having benefits to help stabilize that, remember earlier I said there's a revolving door. Well, that revolving door is going like this. We need the revolving door to slow down. By having benefits, it will slow down. It will slow down. Replacing a driver costs more than improving your benefit package. Really think about that. Again, if you truly analyze the cost of what it takes to hire somebody, train them, get them onboarded, the whole ball of wax, it literally costs more to do that than it does to provide simply a benefit plan. So healthcare is not equal to cost. Healthcare is the infrastructure. Healthy drivers are productive drivers. Benefits should stabilize your business, not destabilize it. Benefits should be a stabilizer for you. Cost drivers are controllable. Those cost things that I was explaining earlier that are rising costs, they're controllable. You just got to have an agency who's going to help navigate that system. So in 2026, make sure you're planning. Start early. If you don't have benefits now, start. If you have benefits, start looking at, hey, how can we improve this? What can we do? Get with your agent. Find out, hey, is there anything that we can do to make sure that we don't get future large rate increases? Talk to them. Talk to us. Benefits protect margins and people. So this isn't a one-size-fits-all, as I said. If you want to see what the real cost looks like for your operation, again, get with your agent. Get with us. Come by and visit us over at booth 401. I have a full staff sitting over there ready to talk to you. We can talk to you about concepts and ideas, but I love this. I had a gentleman that came to me yesterday, and young man, he said that he's interested in working for us. Because he said, what I like is you actually try to provide solutions. He said, I'm a salesman. but I want to provide solutions. And that's what we pride ourselves in. Listen, it's about providing solutions to you. So let me give you a couple case studies, because I want to give you some proof of what can be done by having something like Concierge, by having something like the advocacy team. So get this one. You should be seeing on the screen, this is a $1 million cancer claim. This person literally was diagnosed with cancer, had over $1 million of bills. We eliminated every single bill. $1 million in charges. Guess what? It never hit the insurance company. Never hit the insurance company. Those kind of things can happen by having that advocacy service, by having that concierge service attached to your plan. So again, no premium spike. This happened to be, the next one here happened to be, and this is very recent. So we had a driver, his hip was really messed up, he stopped, he had to quit work. Here's the beauty, with us, he kept his health care plan. Now, not through the employer anymore, but he kept his exact same health care plan. And by the way, look at the price. He was spending $288 a month, that's it. That's not your normal Buca pricing. $288 a month, $79,000 surgery, eliminated it all. Every bit of it. Now, are we gonna do that for everybody? We're not. Do we do it all the time? We save millions of dollars a year just in medical alone. That's not even counting the pharmacy side, by using prescription advocacy programs, being able to get people the Ozempics of the world, et cetera, at no charge for 12 months. $25 charge, $50 charge a month. That's it. So, zero out of pocket there. I do want to tell you this one story, and we don't have it up here, and this is a real fast one. We had somebody that had telemedicine. They came down with stage 4 cancer. Telemedicine, that's all they had. Now, with our telemedicine, we attach advocacy. So think about it. Again, I told you earlier what telemedicine is. You got telemedicine, do you think that's supposed to take care of cancer? It's not. But our advocacy program went in, found the hospitals, found the doctors, found the treatment, and again, telemedicine only at $30 a month. With our advocacy attached, no bills. So this isn't about marketing, this is about building trust, and these are real stories, and we have tons of them. We'd love to tell you about them, we'd love to help you out. So healthcare is your biggest uncontrolled cost unless you control it. If you want healthcare to protect your margins instead of eroding them, come talk to us. We're here to help you. Go talk to your agent, go talk to your agency, see what they can do for you. I told you we're gonna have the Q&As, so if you've been submitting questions, I know we already have a couple, so let's go ahead and let's stop here. Let's take a couple of questions and then I'll close with the deal. You got a couple of questions. Do we have a mic? Oh, right there. So this is Zach Bloomfield. Zach is my sales director at my office. He'll be over at the booth. DC's over there somewhere who works for him, et cetera. But what's a couple of questions that have popped up?
We got one from Micah. If I have bread routes and FedEx routes, can I have the same policy? And how would that work?
Go ahead, take it.
So you can have the same type of plan. It depends on if the bread routes and the FedEx routes are different EINs. So you wouldn't have the same technical policy. It's based off of your EIN. But you can have the same type of plan. The way that we've built our program, you can. Now, a typical broker, maybe not, because they're going to go off of the SIC code and everything like that. But the way that we've built it, where we've gone to carriers and kind of molded these plans to kind of fit a specific space, we don't worry about the SIC codes as much.
And by the way, one of our, I don't know if this was a question about deductibles, et cetera, our highest today, right now, our highest deductible plan, $2,500 deductible. Not bad. Any other ones?
How many employees do we need to enroll to set up a benefit plan?
2.
2 or 5. We have some other plans that require 5, but 2 or 5. And then there's some different states that have different requirements, but
Yeah, California.
California, but those of you in California know it's a wonky state. We don't currently offer benefits. Do I have to wait to January to put in benefits? Is there a specific time of the year? For group benefits, there's not. The individual market, you have the healthcare.gov and you have the open enrollment period, and that's where you have the specific time of year. For your business, just whenever your plan year is. If you already have a plan, you wait till your renewal. If you don't have a plan, you can set it up whenever you want, and then that month will be the effective date and the plan year renewal.
Yep. Any other ones?
Can you explain the tax advantages? You'd be better at this one for me.
Tax advantages. So, if number one, if you're doing a Section 125, anybody heard of Section 125? So that allows you to be able to. This is one way. Okay, it's the most simple. So the employee gets their benefit deductions coming out before taxes, but what you're putting in and what you're contributing, you also get to save on FUTA and SUTA, the FUTA and SUTA tax. So it saves you in that category. Now, there are other strategic things that you can do. Understand, whatever you're contributing, so let's take from Section 125 for a second. Let me again go real basic. Whatever you're contributing, you can write that off. You can write that off on your taxes. Now, I'm not a CPA. Talk to your CPA, but you can write that off.
I think the last one we have here is, I have employees in multiple states. How would that affect my plans?
Yeah, again, the way we built this, so like, let me just use Blue Cross real quick as an example. So Blue Cross in Texas is different than Blue Cross in Florida. That's different than Blue Cross in Ohio. The way we built our plans with the PPO network, we're national. So they can go anywhere, be anywhere. So if you have employees in Ohio, employees in Texas, employees in California, it's all still the same PPO network. There's no situation, no differences. Again, though, there are some state regulations on certain plan types and how many employees, but literally we've been able to build and navigate that system extremely easily. That it? All right, so let me close with this. So healthcare is your biggest uncontrolled cost, as I said, unless you take control of it. If you want to protect margins, instead of eroding them, come see us. Please, come see us. Make this work for you. Remember, benefits are about them. I know you want them. We will also take care of you, but I am telling you, you gotta think about them. It's about fitting their budget and their needs. And then your budget on top of that. But you got to build the plans that. Don't try to shove a square peg in a round hole.